Jim and Sam have entered the Dabbleverse.
Cool.
How exciting for them.
Well, Rich Voss made the mistake of making a joke on Twitter when Chad Zumock and Stuttering John were talking about gigs. And Rich said, I thought you guys were enemies. I can't keep track of all this middle drama. Now, when you call somebody a middler, that means, they're not a headliner. That's somebody that goes between the host and the headliner. And John got extremely offended by that again, to the point where if this had been the original thing, we'd be talking about the middle verse, not the Dabbleverse. But he got mad that, I've been headlining. He started showing Rich, who was just being an ass. He does this to everybody. He calls everybody a middle. John started sending pictures of him headlining at all these places. Of course, they were all from 10, 15 years ago or whatever. And Rich was just laughing. So they talked about it on My Wife Hates Me, which is still one of my favorite podcasts. And then Rich was on Jim and Sam. And Sam brought it up, said, you're in the Dabbleverse. It turns out that Sam Roberts knows pretty much everything about the Dabbleverse. He's been following it all this time. So he's too highfalutin to go on maybe WATP or something like that. But we might be able to get him on our Patreon show as, one of the exam room guests. He's not too big for that. And wouldn't it be fun if we could get him to Rochester for DabbleCon too? So we'll work on that. But anyway, that's big. So now the Dabbleverse has expanded to these other things. I'm going to be at Hackamania May 31st through June 2nd. Check out your tickets there. It's hackamania.com's offer code Cardiff, I believe, is the correct offer code for that. So anyway, all right. You got anything for us today, Dr. Scott?
Nope.
Tacey, you ready for some topic time?
Sure.
All right.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Well, hello to the most boring part of this episode.
That's the things that are coming out of your mouth, John. Babbling. Insanity.
Yeah, okay.
Delusion.
So that's enough of that. So I'm going to go over a couple of weird diseases here.
Okay.
The first one is congenital insensitivity to pain. This disease is present from birth, which inhibits the ability to perceive physical pain. It is caused by mutations in specific genes, particularly in an autosomal recessive pattern, which is 2 inherited gene mutations,
Right.
one from each parent.
Right.
People with
Both parents have to have the gene for this to be expressed.
Yes. People with this condition can feel the distinction between a sharp and a dull object and something cold or hot. However, one cannot sense that the hot beverage is already burning their tongue. Unfortunately, there is no known cure for this condition yet.
Do they say what the mechanism is for this?
No, they just say symptoms include loss of smell and decreased ability to sweat.
Okay, because so yeah, a lot of these genes do lots of different things. But if we could harness this, I could maybe stop prescribing so many opioids for cancer pain.
Yep.
If we could figure out what it is about those people, and they're rare, that causes them to not perceive pain. Because, that's a big part of my job.
Oh, gosh,
then the opioids are, they're an issue. We have lots of chronic pain patients out there that are having difficulties with, getting opioids and stuff like that. If we had something like this that was, say, non-addictive, but allowed patients to live their life without feeling pain. Now, my question, Taste, does it say anything that those people walk around with wounds all over their feet because they can't tell?
No, it doesn't say. I read you everything that it said.
Okay, because people who have neuropathy,
Right.
that cannot feel pain, say in their feet, get these things called Charcot joints, and it's just a cumulative number of microfractures because they can't tell that they've injured themselves, so they just keep injuring themselves.
Mhm.
That's a different thing. These people can actually tell the difference between sharp and dull. So I suspect they're walking around not having a bunch of wounds. I've never seen anybody like this.
Oh, no, yeah.
It's so rare that it's just not something, and they didn't teach us about. But I'd like to learn more about that. Will you put that down for research for next time?
Sure.
We always say we're going to do that,
And we never
and then we never do it. But we,
I was thinking too, though, what would be really, really, really interesting if they don't or do feel visceral pain,
right,
because that's one of the hardest things that we treat,
right,
or organ related pain, as opposed to, a stab or a cut or a broken bone, but organ related pain is really kind of challenging to treat.
yeah, and that's okay. Now this person, here's case presentation. A 12-year-old boy presented with chronic osteomyelitis, so that is infection in the bone. He was the fifth child of a consanguineous couple. That means they were related.
Mm-hmm.
They say Upper East Tennessee is the center of tranquility and consanguinity. Yes.
Right.
So in his birth history, he had a low APGAR score, blah, blah, blah. Okay, let me see. He had no reaction to pain, could not feel pain or heat. Brain CT and lumbar puncture findings were normal. They did a bunch of things, different tests. He had some mental, deficits. Yeah. So, but he had an infection on the sore on the heel of his foot that was wide open. So this guy, at least, had a wound that
he
couldn't feel, and
Yeah.
so he was just walking around in this giant wound. Now, here's somebody with a 13-year-old girl had a deep sore in the heel of her foot. I'm translating from medical terminology to normal human speech. And she suffered from absence of normal reaction to pain. She occasionally had convulsions, high fever, and etc. So she had this harmful deformity in her heel, and antibiotics were ineffective. They did an amputation. So yeah, some of these folks that have this have fractures and things that they're just walking around on. So it's not a great thing at all.
Mm-hmm.
And it's called CIPA, as Tacey said, congenital insensitivity to pain, and anhidrosis, meaning that they don't sweat, which also puts them at risk for heat stroke.
Yep.
Because if you don't sweat and you have very little mechanism for cooling your body down, if you're out in the heat, you can die from that. So, all right. It says here, they must regularly visit their doctor to receive a full workup to be sure that they don't have any insensitive internal problems, as Scott was saying. So I'm going to give both of you a bell on this.
Give thyself a bell.
That can be
doesn't
fatal.
matter. It's even now.
There's 60 documented cases in the United States, so very rare. Wow.
That's
Okay.
pretty rare. It's crazy.
Yeah, the reasons for death among patients with this condition are things that could otherwise be treated. A heat attack is much more dangerous for them because they don't feel it, and they often experience trauma, bony fractures, and osteomyelitis because of insensitivity to pain. So yeah, that's unfortunate. It would be nice, but still, if we could turn on an insensitivity to pain, if we could figure out what the mechanism is for people short term, either post-operatively or people with cancer that have severe debilitating pain, that would be a great thing. So that's these folks are, a topic for research, further research. All right, very good. That's a good one, Taste.
Good one,
All right, what
Taste.
else you got?
Alice in Wonderland syndrome.
Uh-oh.
Uh-oh.
This neurological syndrome is called the Todd syndrome. It usually presents migraines that can distort a person's body image, including the size of the head, hands, and feet. Patients can also experience hallucinations and the feeling of time passing by either slowly or quickly. Sadly, Alice in Wonderland syndrome has no proven effective treatment yet. However, a treatment plan consists of migraine prophylaxis, and a migraine diet may help.
Wow. Yeah, they're saying the most common treatment for this is a migraine diet. The hell's a migraine diet?
I don't know.
No chocolate,
Nothing
no
good.
no
Good.
red wines,
Yeah.
all the good stuff. Probably would eliminate alcohol and everything.
Well, that says, okay, half your grains should be whole grains. Vinny Tortorich wouldn't like this. Fruits and vegetables, healthy fats, magnesium-rich foods, reduced red processed meat and carb intake. Yeah. Okay, interesting. All right.
Very interesting.
That sounds, I bet that's pretty half-assed in its, in its response to
Anything.
Alice in Wonderland syndrome. But anyway.
Yes, they could have come up with a better name, I think. To make
Yes.
it sound
Well,
more-
but I mean, this diet, it's just a normal diet.
yeah, not a healthy diet.
Go eat a normal diet. Well, it is true. If the rest of America is like our child, then he is not eating a normal diet.
Right. Crazy.
I mean,
Right.
Zaxby's. We should buy stock
21
in
years
fucking
old now.
Zaxby's.
Oh, I know it. I know it's insane.
Yep, Liam, the little kid from the Ashley Madison commercial, is now 21. It's nuts.
It's hard to believe, isn't
Yeah.
it?
All right. Go ahead.
Okay. Hutchinson-Gilford progeria syndrome.
Okay.
Gary, okay.
It's an extremely rare condition wherein a person goes through a rapid appearance of aging beginning in childhood. Oh, are these little people they used to put on talk shows?
Yes.
Yes.
Okay. It occurs in 1 in 4 million, with more than 131 cases reported in scientific literature globally since 1886. They have alopecia, aged-looking skin, brittle, fragile bones, kidney failure, joint abnormalities, loss of eyesight, and loss of fat under the skin. No cure.
Yeah.
Yeah.
Yeah. That's a rough one. They don't live very long either.
No.
Yeah, this says there is no cure. However, in November 2020, the FDA approved lonafarnib, a drug that can help
Lonarfinib.
reduce the risk of death due to the disease.
Really?
Mhm.
Okay, I'm
So
going to look at
Kenvy.
that. While I'm looking that up, I was going to, since it is Liam's birthday, I thought playing his Ashley Madison
Yes,
voice
please
track
do.
would be
That is the best.
When my mom is a my daddy is at ashleymadison.com. There he can lots of other women. When I grow up, I'm going to be an Ashley Madison man because my daddy's raising me without any moral compass whatsoever. Ashley Madison, find your lovers here. Why exactly are we singing this? Daddy, what's a rotisserie?
So, anyway, good boy.
Gotta love that
He
one.
was a good boy. Back then, he'd say anything I told him to say.
Back then he was good.
Not
Yeah.
so much now.
No.
And he, there's one bit I'd love to play is the feud between him and Dave McDonald.
But it got out of hand
It
quite
got
quickly.
so out of hand because they were doing sort of a wrestling thing. And look here, McDonald, because it started with Dave McDonald saying that Liam kept touching his daughter's head when they were here.
Mhm.
Stop touching my daughter's head. So then Liam did a response and called him a doo-doo head or something. And then Dave was like, no, you do not call me a doo-doo head. You can call me and then all these horrible things, but not a doo-doo head. And then it was off to the races. And Sam and I was talking and said, this is a really kind of a fun bit. We could do some stuff with this.
Mhm.
And then all of a sudden, on one of them, Dave on his show, which I think was it special? What was it called? Special Delivery.
I don't remember.
Started saying, Liam, have you ever had sex? Now, at this point, Liam was 7, and he was talking about how the things he was going to do to Liam that were in a sort of sexual, realm.
Oh,
And it
no.
was like E-Rock called me and said, you got to stop the bed. I mean, Dave ruined it.
Oh,
And it got really, really
Yeah,
bad.
it
really
got
bad.
really bad. And I was getting
I s-
calls on it. And I'm like, I don't have anything to do with
Right,
it.
right. But yeah, Tacey's friends were calling her and saying, what the hell is going on with this thing? So yeah, we had to stop.
Yeah, we had to stop.
It just, he was 7.
Mm.
But anyway,
Well, and Dave should have known better. I don't know
he
what
did.
he was
He's
thinking.
he was being funny, and he is funny. I just talked to him the other day. He's doing very well.
Good.
And he's he got invited. He's a smart man. He's got a real job and, doing radio in a real market. And he was invited on some show and he was like, you know what? Nah, I'm kind of out of that business now. I've got to be an adult now. And so he is. So I'm very proud of him.
Good.
Yeah.
Cool.
Dave, there are times that he's made me laugh harder than any other human being
He
on
is
this
quite
earth.
funny.
So
Cool.
I've got 2 more real quick ones. And then I've got the thing you sent me, but
Okay.
I feel like we've gone on a little long.
yeah, okay. Yeah, that's fine.
Alkaptonuria.
What?
Alkaptonuria,
Yeah.
also known as black urine disease.
Yeah.
Inherited disorder that results in a buildup of chemical called hemogentisic acid in the body, staining the tissues dark.
Are you talking about alkaptonuria?
Yeah.
Okay, very good. All right.
In
Yes.
addition, the condition prevents the body from entirely breaking down 2 amino acids called tyrosine and phenylalanine.
Phenylalanine. Yeah.
That are responsible for body pigmentation. Sadly, there is no treatment cure for this condition yet.
Yeah. Yeah. So it's a deficiency of the enzyme homogentisate 1,2-dioxygenase. So there you go. And it's just weird, we have all these enzymes. If you're missing one, it'll have these effects. And this is the effect of this one, is it gives you black urine. Are there any downsides to having black urine, Tace?
No, but there's no treatment for it.
I know, but do we care? The reason is there are some long-term effects of this. When people with alkaptonuria get into their 30s, they start having joint problems.
Okay.
And so they'll have low back pain, stiffness, and then their hips, knees, and shoulders. And, you see people with osteoarthritis at a young age. I've never asked them if they have black urine, but I would assume that they would have
tell
told
you.
somebody.
Yeah, you would think.
But it makes their cartilage brittle. That is
Mhm.
what it does.
Mhm.
Now, they may develop brown spots on the whites of their eyes. That would be a way to pick that up. So if you're looking in someone's eyes and you see a brown spot on the sclera, the white part, you could say, hey, is your urine
Pea
weird?
black, yep.
Yep. And the earwax would be black.
Oh,
Yep. They may have, because the bones and muscles around their lungs become stiff, they may also end up with trouble breathing. And then they can have discolored sweat that stains the clothes. And they could have blue places on their skin. There's all kinds of stuff just because of this one enzyme.
Jeez.
Isn't that crazy?
Wow.